Understanding ovulation. How it affects your fertility. Ovulation is the process by which a woman's body releases an egg from the ovary. It typically occurs once a month, around day 14 of a 28-day menstrual cycle. The release of an egg is triggered by a surge in luteinizing hormone, LH, levels in the body. This surge usually occurs 24 to 36 hours before ovulation. Ovulation can be predicted by tracking changes in basal body temperature, cervical mucus, and LH levels. Ovulation predictor kits can also be used to detect the LH surge. Ovulation is necessary for conception to occur. During ovulation, the egg travels through the fallopian tube and is available to be fertilized by sperm. Fertility is highest during the days leading up to ovulation, and decreases rapidly after ovulation. Understanding when you ovulate can help you predict your fertile days, and increase your chances of getting pregnant. Irregular ovulation or anovulation, lack of ovulation, can be caused by a variety of factors including polycystic ovary syndrome, PCOS, thyroid disorders, and some medications. If you have irregular ovulation or are having difficulty getting pregnant, it is important to consult a healthcare provider who can help investigate the underlying cause. Ovulation can be induced with medication, such as clomiphene citrate or gonadotropins, in cases where ovulation is not occurring naturally. Monitoring ovulation can also be helpful for those who are trying to avoid pregnancy, as it allows you to predict your fertile days and use contraception accordingly. It's important to note that just because a woman ovulates, it does not guarantee that she will be able to conceive. Other factors such as age, overall health, and the health of the male partner also play a role in fertility. By understanding ovulation and how it affects fertility, you can make informed decisions about your reproductive health and plan for your future family. Understanding ovulation. How it affects your fertility. Ovulation